Some of the ways that you can contract this virus. Is it airborne or, touch?
So it is droplet spread, which means that it is caused by coughing, sneezing. In the way that we protect people is by staying at least 6 feet away from them. That's how far we know droplets do spread. There are certain procedures that make a lot heavier droplets, and not heavier, but more fine droplets that spread farther. Those are called aerosol generating procedures that we take extra precautions in the hospital, and that's why we do some special masking during those procedures. It can stay on hard surfaces for quite some time, and so that is why it's extremely important to wash your hands regularly, to clean handles and surfaces, and this is also some of the benefit of social distancing.
Talk about, you mentioned how it can stay on surfaces, and a lot of folks are using the Shipt, people bringing groceries to their door. How important is it to, wash down those plastic bags or the Amazon boxes that come to your door, the food that might be in it? Do you have to wipe all that down? Is it that specific?
I would say that is not without zero risk, but I would say that you also have to be reasonable. So it is not practical to wipe everything down. And I think the places we know that it spreads the most is places where there are high touch surfaces. It does not do well on porous materials like cardboard, and there is certainly a limit to how long it can stay in place. So for me, practically in my life, I spend time on door handles, light switches, high touch surfaces. But in the setting of getting groceries, that is not something that I'm spending a lot of time with my family disinfecting regularly.
And also, one final question. You talked about how it can get airborne with the sneezes and the coughing. Does it stay in the air for a while?
So again, the airborne term means something different in the medical world and in the community. So airborne is something that we deal with diseases like tuberculosis or measles, but we say it's droplet spread in the community for COVID-19. It does not stay in the air for a long period of time when you're not doing procedures that are unique to the hospital. So if you are not doing some of these unique procedures that you would get in the hospital, this is not something that stays in the air and that you're at risk of just getting as you walk through a room that someone previously might have been in.
All right, Dr. Jameson, thank you so much for your time. Some great information this morning. We appreciate it. And for more information, you can visit mercyhealth.com or call the COVID-19 hotline. That's at 1-833-247-1258.